In recent weeks, we have been seeing a steady increase in coronavirus cases across Victoria, but concentrated largely in metropolitan Melbourne. And today's numbers just demonstrate the gravity of the situation. 122 people now in hospital, 13 more than yesterday, and more people again in our intensive care units. So I do want to impress upon all Victorians the seriousness of the situation and the need to follow the rules and exercise common sense. We're keeping a very close eye on regional Victoria, and whilst the numbers in regional communities have been lower, we've had about 42 cases since the 1st of July, we're keeping a very close eye and monitoring the data on a daily basis, and it's very important that regional Victorians do not become complacent. This is why we are stepping up our ability to identify and respond to cases in regional communities. We're going to do that in a number of ways. Firstly, we'll be stepping up additional testing capacity. We have 160 different testing sites across Victoria at the moment, of which 60 of those are in regional communities, and we're looking to establish new sites or expand existing ones to make it easier for regional Victorians to get tested. So those new and expanded sites will be in a number of communities across Victoria, in Campaspe, at Echuca Regional Health, at Bass Coast Health, that is at Wonthaggi Hospital, in Greater Bendigo at La Trobe University Rural Health School, in Greater Shepparton, based at Goulburn Valley Health, in Kuirup, based at the Kuirup Community Centre, and also in Mildura, providing a drive-through facility there. And we'll be providing and establishing further testing sites right across Victoria, including in regional communities, in coming days and weeks. We want to encourage regional Victorians to not be complacent, to do common sense things like staying home as much as possible, but particularly if they are sick, it is vital that they stay home and they present to be tested even if they have mild symptoms. We have had some cases of people who might be commuting to Melbourne, going back to regional communities, and therefore infecting their family members. So it's important that people are aware that there are risks at the moment in regional communities, and that they need to take every step possible to keep themselves, their families and their loved ones and their entire community safe as well. We're also stepping up our ability to trace regional cases. We're establishing public health teams in regional Victoria for the very first time. We are facing a once-in-a-100-year event here with this pandemic, and so now we are going to be establishing 5 public health teams based at regional health services to enable local people, local clinicians based in those health services to do the contact tracing and identify cases in the local communities that they know best. We're starting with Barwon Health. That team of 10 clinicians will be on the job from this week, and then we will be establishing further sites in Bendigo, in Ballarat, in the La Trobe Valley, and also in Shepparton. So all of those communities, and potentially more if there is a need to do so, will have locally based public health teams on the job doing that disease detective work and making sure that their communities can stay safe. So I just want to conclude my remarks in saying that we have seen great tragedy this week. We've had 3 elderly Victorians lose their lives sadly in the past 24 hours, and I want to express my condolences to their families. And we've had other families who've experienced tragedy in recent days as well. This is a very serious situation. We are in the fight for our lives. And I want to impress on all Victorians the need to be vigilant, to limit their movements. They do not need to be exercising outside of their local area. They do not need to be going to the shops every day. Limit your movements, follow the rules, and we will get through this. We are all in this together, and it's important that we all take this situation very, very seriously. Thank you.